Hey everyone, this is Dr. Brendan Cochran at Interactive Health Clinic. Today I want to talk about ozone. So ozone, this specific context, we're going to talk about it in pain and regenerative medicine. So ozone is a gas. It's actually 3 oxygen molecules. So what we do to make ozone gas, we take an oxygen tank, medical grade oxygen, which is 2 oxygen molecules, and we run it through a medical grade ozone machine, and it creates a electrical charge. That charge splits the oxygen molecules up, so then your byproduct is O3, 3 oxygen molecules. Some of that byproduct, and actually most of it, is still O2. So you have oxygen plus ozone as the product that's produced from the medical grade machine. Now it is important if you're getting any medical treatment with ozone that you are using a medical grade machine. There's a lot of machines out there that even doctors' offices try to skimp on because it's a cheaper deal, and the components actually deteriorate and it can be carrying toxic substances into your body. So in our office we use some of the top machines that are available out there, as it's extremely important for me and my patients, but also I educate many doctors around the world on how to use ozone safely. Now, what are some of the myths of ozone? Ozone is toxic. Well, it is. Just like if you drank too much water, that's toxic too. You took too much of a vitamin or a medication. It has a therapeutic level, and that is absolutely correct. Now, one of the ways that we use ozone is there's a window of range that it's safe to use in your body, and it's very effective to use. It is very toxic to breathe into the lungs, so we never recommend anybody breathe it into the lungs unless it's specifically done in a manner where it's run through a process where it's not just straight ozone gas. The lungs don't like it, and it is very toxic to the lungs. Part of that's because the lungs have one of the weakest antioxidant systems, so they just can't handle the oxidative load. So another thing that comes up is ozone is sterilizing. And this is incorrect when it's applied to the body. So if we're to inject it into any tissue in the body, it absolutely does not sterilize the tissue. It doesn't kill bacteria, viruses, fungi directly. It works by being an immune modulator or immune stimulant. So when you inject it, there's a bunch of biochemical reactions which stimulate immune function or modulate immune function. It does not sterilize things unless it's externally applied, where you don't have certain enzymes that break it down rapidly. So one of the things I've seen a lot with some of my patients, because they read these articles, or some of my doctors that I'm educating, is it can be injected into the body and I don't have to be worried about clean technique. Oh, run if you hear that. You absolutely still need to have a clean technique when injecting this or delivering this medication into the body, because it is not a sterilizing agent. So why do we use it in pain? Well, when we use it in pain for injections with a number of different things, alone, other nutrients, or with things like PRP, platelet-rich plasma, we find it extremely beneficial in stimulating those cells that are remodeling your tissue. So the fibroblasts or chondroblasts, it actually makes them more active. So they basically get a stimuli and say, hey, there's an injury, we need to go and repair this tissue. Ozone can do that. Another benefit is we're oxygenating the tissues. So we're delivering oxygen to those tissues, so metabolically they can remodel or repair more rapidly. So in this sense, it's a regenerative technique versus just shooting you with steroids, which shuts everything down and actually makes the process deteriorate faster. Now, does this work very rapidly? Well, it takes time, depending on how severe your injury is, to remodel that tissue. If you've been working on that injury for 5 to 10 years, one injection is not going to work. So most people that come in, it may take anywhere between 6, 8, 10 injections to actually get that tissue to remodel. The other thing that is a determining factor is how many steroid injections have you had? Remember, steroids shut down all natural inflammation and repair. The more of those you have, the more stimuli I need to do to turn back on that inflammation and that repair mechanism. So when anybody comes in and they ask specifically for ozone therapy, there's a lot of different questions that we need to go through, and then we can give you some more information, how long the treatment's going to last, how expensive is it, how effective is it, is this the right tool for you to use? An analogy I like to use, when you build a house, you don't use one tool, right? So I would never go and say, I'm just going to build your house with a hammer, because it never works. So a lot of the times when a person comes into our office, it's one of many different tools, and we may have to choose something stronger, which means you may not start off there. It may be that you need PRP with ozone, or ozonated clot matrix with ozone, or stem cells plus ozone. So we need to evaluate you comprehensively, and then we can propose if this is the right treatment for you. It's an extremely powerful agent. However, nothing is a magic bullet, and we use our tools collectively and efficiently to get results, because that's what I'm about, is outcome-based medicine at Interactive Health Clinic. We want to choose the best tools, the best approach to get the best outcomes for you the fastest manner. To learn more about our personalized approach at Interactive Health Clinic, give us a call at 425-361-7945 or visit our website at interactivehealthclinic.com.